Roger and I will be doing a fast and furious overview of a few different projects, but really the hope here is to get you excited, get you settled in for a great afternoon and to promote some great discussion. So I'm going to share my slides here momentarily and we will dive right in. Okay, so hopefully everyone can see these slides. Maybe we'll see some thumbs up from the audience if we can. So we're going to kick off here with a quick presentation around some of the work I've been leading. I'm really proud to lead with some great colleagues, Kelly Arbor and Emily Bremer, around concussion research within Special Olympics Canada. So let's do that. What I want a takeaway from this isn't necessarily the findings. This is some preliminary work and some ongoing work. But the key here is to really stress that there are communities and sport communities that have been ignored in this space to date. And we as a group, as a collective, as a society, we need to bring concussion education to all sport communities. And this is a great example of that. So if nothing else, hopefully this sparks some interest to dive into some other communities that you're involved in or you're aware of and increase concussion awareness everywhere. So the first part of this project that we've been doing is really exploring the concussion knowledge, attitudes, and intended practices of Special Olympics Canada coaches and caregivers. And the reasons for this, I think you all are aware, but we know all athletes are at risk for concussion. We know to date there's been very little research conducted on concussion within athletes with intellectual disabilities. And certainly we know Special Olympics Canada is working really hard to educate their members and their community. And we wanted to get a sense of what that uptake is and perhaps identify some ways forward to improve implementation with this information. So our objectives for this study were simple. One, to get a survey out there to see how much Special Olympics Canada coaches and caregivers know about concussion, what their attitudes are, and what their intended practices are with that information. And as well to see which of the available concussion education resources are used by Special Olympics Canada community. So are they being used? Are they not? And how do we facilitate some of that use? Because these resources are fantastic. We just got to get them into everyone's hands. So as I mentioned, we used an online survey for this, and it really looked at some demographic information, some true, false information around concussion knowledge, again, attitudes around concussion, how people might respond or behave to a concussion injury, and again, thinking about those concussion resources that people typically use. Just to give you a little bit of what we found here, and again, to let you know, this is preliminary work, so more to come, but of the survey respondents, so we had about 134, mostly coaches within the Special Olympics community. We did see a really nice spread across the country within this number, so we were really pleased with that. And something really interesting I thought I'd share is this idea of how few of our caregivers in particular had received concussion education to date. So really lots of opportunity to think about what does this community need to know about concussion and how are we going to deliver it. A really interesting finding here was related to those concussion education resources that the Special Olympics community already has access to. And we just wanted to see how many of these resources were being used. And from our survey respondents, we did realize that not a lot are using these, especially our caregivers, but even in our coaches, not many had used a lot of these great resources, concussion policies, website, provincial education. These things were being underused. And we want to identify that, not to say it's a problem, but to say we have an opportunity here. How are we going to fix this? A few other key findings, some very positive intentions of our participants around concussion. Certainly saw the priority of keeping athletes safe across the board. We also saw that most coaches thought it was important to be knowledgeable about concussion, so 93%, but only 59% felt they had the knowledge to really recognize concussion symptoms and help their athletes. This idea of knowledge around emotional symptoms, mechanism of injury, and concussion protocols is an area that we saw some lower knowledge scores on. So certainly something we can improve upon with our educational initiatives moving forward in this community. 82% of coaches felt they were responsible for recognizing symptoms, so the identification of a concussion in a sport environment, and 80% felt they had a role in managing that return. So coaches see themselves as a big part of this picture, and we need to support our coaches to have the right information and tools to do that. As I mentioned, previous concussion education was not commonly accessed, so about 94% of our participants said that they although 94% of our participants said they were really motivated to learn about concussion. So there's a bit of a disconnect between providing the info and that level of motivation. So we can connect those dots, and we're going to do that with more work. And as I said, not many of the resources were accessed by the majority of our participants. So something we want to look at a little closer and try to facilitate some ways to get the right information to the right people when they need it. Some next steps here, we really want to focus on improving understanding of concussions and also thinking about the specific roles of coaches and caregivers in the concussion space and building that into our education initiatives. And certainly this idea of increasing awareness and accessibility to our concussion resources and education and thinking about new ways of doing that. That leads me to our next project, which is ongoing right now. We're super excited about this. And it's an opportunity for us to co-create a concussion education toolkit for Special Olympics Canada coaches to then share with their athletes and caregivers at a single practice every year, a concussion practice, we could say. What we're doing here, our research objective is to conduct some focus groups to really co-create this product with our Special Olympics Canada coaches so that we're really knocking this thing out of the park and that we can use it in a feasible way, but also create something that's going to share information in a way that's relevant for these athletes. So we've started our focus groups. We've conducted 2 focus groups with coaches, and we're planning more with athletes and caregivers, really focusing our questioning around perceived concussion knowledge, lived experiences with concussion. How do we share information, not just concussion information, but all information with athletes with intellectual disabilities? Thinking about that learning environment, what does a practice look like? What environments and contexts do those practices take place? And how can we share concussion education in them? Just a little sneak peek around some of the findings so far. For one Special Olympics coach that was in our study, really focusing again on this idea of sharing information with athletes with intellectual disabilities and perhaps taking some different approaches. Maybe it's not an online webinar or some printed out materials, but rather a lot of verbal and demonstration and getting feedback from the athletes themselves. Making sure that the athletes understand what we're telling them and they can demonstrate that understanding in a visible way. So more to come on that. We're really, really excited. It's ongoing. If you know anyone who could be interested, please connect them with me. And we're just so excited to co-create something that's usable and relevant for this community and to shine a spotlight on the Special Olympics community when it comes to concussion. So stay tuned for more. Just some resources that I wanted to share with everyone. Again, there's some fantastic work in this space around getting information out to the Special Olympics community. So just sharing some of these, a web-based e-booklet, an information sheet that I know Parachute and the Government of Ontario helped immensely with, as well as some video education that everyone can check out. So please take a look and please share broadly. That's it for my first presentation. Again, fast and furious. Now over to Dr. Roger Zemek to dive deeper into concussions and mental health.
Thanks, Nick, and it's so great to work with you on this and many other projects. What I want to talk to you all about today was the importance of concussion and mental health. So when children present with concussion, they can present with a constellation of symptoms. Many of them can be physical. There could be problems in which children have problems concentrating and problems with sleep as well. But one of the most pertinent and important problems that we see are emotional changes. While they may not present initially, this is some of the things that most commonly are problematic, especially and in the management of persistent symptoms. Why might this be the case? Sometimes we see children who, after their time of injury, now start to miss the things that they love to do because they can't do those things because of their initial symptoms. That leads to them maybe missing more things, falling behind in school, having more stress. This leads to maybe further withdrawal and fear of actually becoming more disconnected. This can lead to more anxiety, depression, maybe even reliving the event that caused their injury. And eventually, some children enter a chronic state, which can also take on a role of sick role or chronic persistent symptoms. This sick role can also potentially be associated for higher risk of suicidality or self-harm. Why is this important? Well, we do think that some kids will follow the emergency department visit or their family to their doctor and be told, you need to rest and take care of yourself. Later on in the talk, Nick and I are going to be talking updates to guidelines, and hopefully we can convince you this is no longer the best case with evidence, but those disconnected can actually maybe be an explanation to why mental health may even be worse for those kids who are avoiding the things that they want, love, and need to do. It's important not just to study symptoms. It's also important to study if someone is well. How do we define wellness? It's quite a heterogeneous construct, and there's no single agreed upon definition, but the World Health Organization defines wellness as it's not simply the absence of disease. When you look at all the different constructs, it's important of absence of being impaired, doing protective factors, good quality of life, good health, getting back to, again, the things that you like to love and need to do with satisfaction. So when we looked at wellness and concussion, on the next slide, our 5P study for which we enrolled over 3,000 participants, Miriam Beauchamp and I and others looked at what were the predictors of not just absence of symptoms, but had they returned to being well. And when we looked at the predictors of wellness, they were slightly different than the predictors of being symptom-free. We did see some similar trends in which older kids and girls did do worse than boys in the fact that they were more unwell at the outcome. But what we found some interesting things. One thing that should be reassuring, especially to this audience, is youth who are injured in sports injuries actually are more likely to be well than those who are injured in other mechanisms. That may tie into the PTSD of things like assaults and motor vehicle collisions, however. We also see the importance, especially as a proceeding to Nick's talk, those with pre-existing developmental problems or other sleep or mood disorders are higher risk of having being unwell as the time of follow-up, and further, patients who have a harder time concentrating or making their memory work well are also more likely to be unwell. This may tie into their ability to do well at school. So if we look at the next slide, one of those factors that we looked at as wellness was quality of life. This was a study, again, based out of the 5P work, and this is why it's so important that we intervene early. What this looks at is quality of life following concussion, and if you see, the horizontal dashed blue lines are the baseline of the normal age match controls in the community. The people who had the squares are those who had a concussion, but by the time you got to 1 month, they had reported no symptoms. But the yellow lines and the triangles represent those who at 1 month were still having symptoms. And you can see that their quality of life or physical, social, remain quite different. And especially if you look at the gaps between emotional and school, those really persist for months and months throughout. So why is that important? Well, we looked at using ICES data in Ontario. We compared over 150,000 youth with concussion and matched them 2-to-1 with almost 3,000 youth who had an orthopedic injury. And what we found was that these kids, when you compared them one to the other, kids who had concussions had, over the next several years, had a much higher risk of having a subsequent diagnosis of mental health disorder. They were almost 50% more likely to have self-harm behavior presenting to a doctor, almost 50% more likely to have psychiatric hospitalization. And while it didn't reach statistical significance, with the outcome being as so dramatic and severe as it is, death by suicide, again, had almost over a 50% higher risk in those with concussion compared to orthopedic control. So what do we do? Well, the good news is we've recognized the importance of mental health and concussion in our guidelines for many years, and we have recommendations for healthcare providers to address this. High-level summary. First, it's important to assess if there's an association between concussions and seeing if that can be explaining their mental health. And as we talk about at our next talk, getting kids back to those things early, the evidence is showing that may help prevent these problems. Second, you need to treat and manage that mental health disorder itself. If you don't, it could become a long-term problem and thus make the concussion even harder to treat. And third, it's important to make sure that child is remain connected and engaged. If you go on the next slide, you can see there's a overview algorithm. I'm not expecting all of you to understand this, but these are the things that are in our guidelines that can help you determine who needs what sort of care and what types of care they need, many of which, though, can be coordinated by an interdisciplinary concussion team. This is a perfect segue because we could talk for hours on the guidelines. We don't have hours, but I'm going to hand it back over to Nick, who's going to talk a little bit more about not only mental health in the guidelines, but some of the more recent updates that we've had over the last short period of time.
Fantastic. Thank you so much, Roger. And as we're moving on with our fast and furious overview here, just acknowledging our amazing team with our living guidelines for pediatric concussion care. Roger and I get the great pleasure of leading this, but we have amazing folks like Jenny Dawson, Andréane Ledoux, Christine Providenza over the years, and of course our funders, the Government of Ontario, to make this all happen. You can check out this guideline right now. It's totally free to access. Go online, share it with anyone that you think might be useful. Great information for healthcare providers, but so much in there for all of us, whether we're coaches, parents, athletes themselves. Great tools and resources and evidence-based recommendations. So the need for this is really coming from all of us knowing that kids get concussions, they need help, and to give them the best possible help, we need evidence-based recommendations that we know we can trust. The Ontario Neurotrauma Foundation started this amazing initiative in 2014. And as you can imagine, the literature around concussion is rapidly increasing every month, every year, and we have to keep up to date in order to make sure these recommendations are truly evidence-based. We turned this initiative over in 2019 into what we call a living guideline for pediatric concussion care. And living just means that it's never out of date. We're reviewing the literature all the time on a bi-monthly basis and changing our recommendations as needed. We have clinical recommendations, algorithms and tools, resources for the public, for all different stakeholder groups. We have a dissemination and implementation activities related, like presentations like this, just to get the word out and make sure all of you have access to this amazing resource. Just to let you know how this works, we have a team of experts across North America, 42 of them, in fact, where we review the literature every other month. If there's new research that causes us to change our clinical recommendations, we put it out there to our experts and we get some voting and a little bit of infighting in a nice way to confirm that we want to change our recommendations. We then change those recommendations if we have our consensus vote and we have the latest and greatest evidence to inform how we all manage our concussions. This is a slide just to show how much of a team sport this is. There's no way this could be done without so many amazing people contributing, many of whom you've heard from today throughout the symposium, and we're just grateful for everyone's contributions. So just to let you know real quickly what this guideline entails is we have 15 domains with about 70 clinical recommendations on how to identify and manage concussion. We have algorithms and tools that we all can use and resources that are just fantastic. It's a nice curation and one-stop shop of all things concussion. And as I mentioned, although many of this material may be geared towards healthcare professionals, we have a lot of fantastic resources for families, teachers, and coaches, and youth themselves to make sure that we're all taking a part in concussion identification and management. So if you were to go to our website, you would see something like this. You could select a domain that you're most interested in. Here is concussion recognition and directing to care. Once you select that, you can see a little preamble on why that domain is important. You can select all the different recommendations that we suggest based on the evidence on how to do this, to take action within this domain. You can expand it, see those specific recommendations along with some levels of evidence to support them. And you can also expand to find all the tools and resources that are going to support carrying out these clinical recommendations. These could be decision-making trees. This could be educational pamphlets that are going to be quite useful. I'm going to pause there and pass it to Roger, who's just going to give you a really quick overview of major recent updates in the guideline that we thought you would all benefit from today.
So we'll do them one by one. So we'll jump to the first one. The first one, Nick, on the next slide is when to refer to interdisciplinary care. Short answer is the kids who get seen within the first week actually do better than those who are seen in weeks 2 to 3. So we actually know that patients who are seen ideally as soon as possible do better. Again, most of experts agree with this minor change. The other important thing is to talk about getting back to life. One of the ways you could do that is prescribed and supervised aerobic activity. This is really important for people who are highly active, especially those in the circ community who want to get back to doing their sports. And by monitoring them in a clinic setting are ways in which prescribed aerobic exercise using the Buffalo Protocol or similar is great evidence and is recommended now in the guidelines with 100% of our experts. The next take home, missing school for more than a week is not recommended, but we even have a tweak. It's going to be coming up in the next update. I was so pleased our paper was published just 3 weeks ago in JAMA Open, and it actually showed that getting kids back to school within 2 days, even after the 2 days maximum off, do the most well. So even more sneak preview of what's to come in our guidelines. And last, we know that especially during COVID, it was really hard sometimes for people to get access to their provider in person. And what the guideline now has included as well is a virtual concussion care manual, which I, Nick, and others on this call today also helped develop to help assist providers to be seeing their patients virtually or who have access problems, especially those in rural, remote communities, to do those follow-up. So again, this is just a high-level snapshot. Our website's available at pedsconcussion.com. And if you go from there, the other things are make sure you tell your friends about it, tweet it, it's linked, share those community resources. They're constantly being updated. We also have some resources as well for those of you who can access the slides later. But I think we're just going to open it up to questions. Thank you so much for this opportunity. And the screen QR code is available for anyone to go directly to the website.
Thank you both so much. That was amazing. And we will definitely be checking out those resources. And I hope everyone else here today will as well. We did get some questions coming in, some for both of you, some for one of you at a time. So I'm going to start with a question here for Roger. And the question is, from your clinical and research experience, are there any strategies you found that could reduce the mental health burden athletes face in their recoveries? And Nick, feel free to jump in too.
So Brenna, great question from the audience member who asked it. I think one of the easiest tips I do is the power of positive thinking. Often one of the things my own career research is in predicting who does more poorly. And even when I see them in the emergency department, I don't say, oh, you're going to do badly. I say, hey, we're going to do everything we can to make sure we get you back and optimize as soon as possible. So let's do this, let's do that, let's do that. So just framing, even when we have a patient who's high risk, number one. Second tip, make sure you talk to that youth or adolescent alone. There's some things that some kids may not want to share with their parent or other caregiver in the room with you. And unfortunately, there are some kids who are having some really hard thoughts, and it's really is a safety issue and importance for that. And third, normalize it. Don't stigmatize it. Say there's ways to do, get people started on the therapy you need. And with that, making sure it's a combination of both a counselor and a physician. While many kids may benefit from counseling alone, there are some kids who do need medication to really get them back to their full selves.
That's amazing, Roger. Thank you so much. And I think just, highlighting the importance of the multidisciplinary team here again, and also just so amazing that we have so many people here today listening about the mental health issues that athletes might experience so that we're all better equipped to support them. So that's incredible. Nick, I don't know if you had anything you wanted to add to that one.
I think it's really important. Something I really focus on is this idea of what can our athletes do rather than what they can't do. So focusing on the positive aspects of someone's day-to-day. What did you do today? How did it go? Great. We're making some great improvements rather than focusing on the things they can't do. Maybe they're not quite back at full competition. Maybe they're having challenges at school. And also trying to get away from only focusing on the symptoms that the athlete is experiencing. So rather than asking that athlete, how's your head today? How's your headache now? What about now? This is something our athletes with concussion hear all the time from everyone, whether it's their doctor, coach, teacher, friend. We could ask them, how did your day go today? What do you need for me to do more things in your life that you need, want, and love to do?
That's amazing, Nick. And the next question is actually for you, so we'll keep you on a roll here. It seems like caregivers and coaches already have good intentions around concussion education, which is excellent. As you make these new resources, I wonder how you will ensure that they are being used and adopted across all levels of Special Olympic sports.
Yeah, and it's so important. First, focusing on that positive, that people want to be in this space. They want to be involved, and they're totally motivated to make a difference for their athletes. So we're going to leverage that 100%. I think it is key to, if we're going to create resources, if we're going to create educational materials, we need to co-create them with the audiences that need to use them and figure out those best ways to actually implement. So the project I spoke about today, this toolkit for coaches, really the hope there is not to really figure out the content necessarily. We know what we want to share, but how do we share it, and how do we share it in a way that's feasible to actually deliver? It's not going to be a burden for the coach. It's not going to be something they forget to do, but something they want to do and it is easy enough to do. That's going to be the secret sauce to this, but we can only do it by putting our heads together and figuring out the best way forward.
That's amazing. Thank you so much, Nick. So I have a question for both of you here. We have someone in the audience wondering if there is a guideline available for older athletes on top of those pediatric concussion guidelines, or even for adults as well.
Yeah, maybe I'll start off, and Roger, I'll let you go, but certainly. So there's an equivalent, an excellent equivalent for those 18 and older. Has very similar process. It's becoming living as we speak, and people can access that as well. Roger, did you want to add?
Again, it's Sean Marshall, also at the University of Ottawa, and his team lead that group, and there's great resources. In fact, it's not just even concussion, it's a little bit more even with the mild traumatic brain injury. So it's the mild traumatic brain injury resources for adults. And like as Nick said, just like ours has been living, theirs is going to be converted to that as well. So hopefully it will be the go-to up-to-date resource for the adults over there, or young adults as well over 18.
And just to add, to access those guidelines, you can go to braininjuryguidelines.org, and you should be able to find those totally free, easily accessible. And please take a look, share them with your friends, like we said, for our pediatric guideline, and just spread the word, please.
Awesome. Okay, we will definitely have to check those out after this session. So another question here, and this one's for Roger. Are children and youth groups at a higher risk of mental health challenges after a concussion, and how can we better monitor the development of these challenges? So I think you answered the first one a bit in your presentation, but maybe focus on that second piece there.
Yeah, so how to monitor it is something that's really important, and that's why longitudinal follow-up. Some people may not need a specialty clinic. That's where having a team as well, and that's why it's so great that the caregivers, the coaches, if they're noticing something wrong, have that patient follow up or athlete follow up with their regular healthcare provider, be it their doctor. When I see a patient in the clinic, there are standardized tools that I will sometimes ask the child. So there's tools that ask them about anxiety, tools that ask them about maybe symptoms about their worries or depression. And those are really important ways to monitor their recovery. And the other nice thing is most of those standardized concussion symptom scores do embed some emotional questions in there too. So it's a great tool for all of us to keep an eye out. So awareness is key, and flag those and who you're concerned are maybe having some of those symptoms.
Amazing. Thank you so much. And we do have one more question from Dr. Tater. When should a child be referred to a psychiatrist?
So that's a really great question. I think one of the things to think about is in the event that the child is not getting better with this traditional first, second, or even third line combination of counseling and or medications. Many of us who are pediatricians will start youth on some of the mental health medications, and you can look in the guideline. There's a list of those that are often sometimes used. But without getting into too much details, if the traditional SSRI or SNRI or other medications are not working, before maybe doing 2 medications or 3 medications, that's where having a psychiatrist would be very valuable in helping manage a more complex management of medications and counseling.
Amazing. Okay, well, thank you both so much. That was incredible. So much information in such a short amount of time. So thank you again for joining us. We really appreciate all your answers to the questions and sharing all of those amazing resources during your presentation. So thank you.
Thank you, and enjoy the day, everyone.